Assalamu alaikum students. Today we'll be studying vitamin B3, which is also known as niacin. Chemically, niacin is pyridine 3 carboxylic acid. This means this is a pyridine ring, and in position 3 you have a carboxylic group attached to it. This is the chemical structure of niacin. It can occur as niacin, or for the physiologically active form, it is present in the form of an amide, which is known as nicotinamide. Okay, so this is nicotinamide. Amide group is attached at the position 3 with the carboxylic group. So this becomes pyridine 3 carboxylic amide. So this is the physiologically active form. Dietary sources. The animal sources for niacin is liver, kidney, meat and fish. Then the vegetable sources, you have legumes like peas, beans, lentils, all those dals and all, nuts, certain green vegetables, coffee and tea, outer layer of cereal grains, yeast. These all are good sources of niacin. The recommended dietary allowance, the daily requirement in adults is 17 to 21 milligram daily. In infants it's 6 milligram, and in pre-adolescents it's 17 milligram daily. So the requirement of niacin increases in different conditions, that is in increased calorie intake or expenditure, like if you're exercising and all, acute illness, you have fever or you have some acute illnesses, after severe injury, infections and burns, pregnancy and lactation. And high corn or maize diet I'm going to discuss in detail in the later slides. Intestinal absorption. So nicotinic acid and its amide are absorbed from the small intestine. Transport. Whole blood transport is the levels are 0.2 to 0.9 milligram per 100 ml. So most of the nicotinic acid and its amide in the blood is in red blood cells, presumably as coenzymes. They act as coenzymes. So we'll see what the structure is and how the mechanism of action occurs. So this nicotinamide adenine dinucleotide, that is NAD, it consists of one molecule of nicotinamide, two molecules of D-ribose and two molecules of phosphoric acid and one molecule of adenine. So this is the structure by which the compound is made. Then we should always remember that the niacin or nicotinic acid is made from an essential amino acid, tryptophan. Okay, so this tryptophan gives rise to niacin, and further it is in the amide form as NAD, and once phosphorylated it is in the NADP form. So NAD and NADP are the forms by which they are acting as coenzymes for different reactions. Okay. So NAD and NADP serve as coenzymes in oxidation reduction reactions, in which the coenzyme undergoes reduction of the pyridine ring by accepting a hydride ion, that is a hydrogen atom plus one electron. So they are acting as coenzyme in oxidation reduction reactions. The reduced forms of NAD is NADH and NADP is NADPH. So NAD is the source of the ADP ribose for the ADP ribosylation of proteins and poly ADP ribosylation of nucleoproteins involved in the DNA repair mechanism. So you know the DNA sometimes has to be repaired. So these NAD this NAD, it acts as a source of ADP ribose, which is necessary for the ribosylation of the proteins that are involved in the DNA repair. So this here they have showed you how NAD takes a hydride ion and it is converted into NADH. Takes a hydride ion and is converted into NADH. Okay. So here we have a list of enzymes in which NAD and NADP take part as coenzymes. So for NAD, if you see here, alcohol dehydrogenase, lactate dehydrogenase, malate dehydrogenase, glyceraldehyde 3-phosphate dehydrogenase, alpha glycerophosphate dehydrogenase, pyruvate dehydrogenase complex, alpha ketoglutarate dehydrogenase complex. So many dehydrogenases. Here NAD is acting as a coenzyme. Okay. And here for NADP, where NADP acts as a coenzyme, is glucose 6-phosphate dehydrogenase and glutathione reductase. Then there are enzymes where either NAD or NADP can act as a coenzyme. So it is glutamate dehydrogenase and isocitrate dehydrogenase. So you can just learn about 3-4 examples so that you know which are the reactions where NAD and NADP are acting as coenzymes. Deficiency disease. So the niacin is really important from the deficiency point of view, because it's been asked so many times in your exams also. So as soon as niacin name is taken, the disease pellagra should just pop up in your mind. Okay, so niacin deficiency causes pellagra. Okay, pellagra has 3D hallmarks. Okay, hallmarks which are 3Ds: dermatitis, diarrhea and dementia. Dermatitis, diarrhea and dementia. There's also a 4D if pellagra is left untreated, that is death. Okay, so the precipitating factors are high corn diet and alcoholism. Okay, now I'll tell you how high corn diet can cause you pellagra. So you have to remember the 3Ds and a 4D if this is left untreated. So in high corn diet, the requirement of dietary niacin, it increases, because as I told you that niacin is synthesized from tryptophan, and if you are taking staple diet with high corn, you are taking maize. You know, there are so many types of diets in which you take a certain type of food, like 3 bananas and milk, 3 bananas and milk, or 2 bananas and milk, 2 bananas. There is a diet also in which people start taking corn, okay, for losing weight, dieting. Okay, so the reason is that the maize, the corn, it lacks, the maize has a protein which is zein. Okay, now this zein lacks the amino acid tryptophan. Okay, now if there is no tryptophan, you're getting protein content for your body, but this protein content does not have tryptophan. So if it doesn't have tryptophan, then niacin cannot be made. So pellagra is more common in person whose staple diet is maize. Got it? So this maize has a protein zein in which there is no tryptophan. No tryptophan means no making of niacin, and no making of niacin causing deficiency of niacin and pellagra. So dermatitis, we said. So dermatitis is like the skin lesions. They typically involve areas of skin exposed to sunlight and subjected to pressure, heat or other types of trauma or irritation. Now these may include face, neck, dorsal surfaces of the wrist, forearms, elbow, breast and perineum. It typically involves the skin exposed to sunlight, but also the hidden areas. Okay, the skin becomes reddened, later browned, thickened, and very and scaly. They are very thick brown scaly lesions. Okay, I'll show you the pictures. See, this is the pellagra lesions, the dermatitis caused by pellagra. This involves the arm and the wrist, the forearm and the wrist. Then the neck. See, this is also known as Casel's necklace because it is in the necklace form, right? So it is also known as Casel's necklace. Here, this lady has this Casel necklace lesion and lesions on her hands. Then here, all the dermatitis caused by niacin deficiency. Okay, and alcoholism can just worsen all these lesions. Okay, here Casel's necklace, here's okay, that was dermatitis. Then diarrhea, GIT manifestation. It includes anorexia, the person doesn't feel like eating, loss of appetite, nausea, vomiting, abdominal pain with alternating constipation and diarrhea. Initially there is constipation, then diarrhea, constipation, then diarrhea, and then diarrhea becomes intractable. Then there is continuous diarrhea. Then there is gingivitis, that is infection of gums, and stomatitis, that is infection of the tongue with reddening of the tip and margin of the tongue, which becomes swollen and cracked. Okay, so these are the manifestations that are occurring in the mouth. Then there is achlorhydria present in about 40% cases. That means absence of acid. You know, our stomach has acid, right? HCl. So there is absence of acid, and then there are so many digestion issues and etc. Then there is dementia. We said dermatitis, diarrhea, and dementia. So dementia is loss of memory. Okay. So cerebral manifestations, you'll have headache, insomnia, that is lack of sleep, depression, and other mental symptoms ranging from mild psychoneurosis to severe psychosis. So initially you might just have headache and then lack of sleep, then depression. You may start having memory loss and ultimately psychoneurosis, and will lead you to mental retardation or psychosis. Okay. So psychosis actually is a chemical imbalance of your mind. They are saying that simultaneous deficiency of B2 and B6, that is riboflavin and pyridoxine, can contribute to the etiology of pellagra because both of these are required for the synthesis of niacin from tryptophan. During the synthesis process, these are working as coenzymes. Okay. In carcinoid syndrome, pellagra can occur. Okay, in carcinoid syndrome, what is happening? There is overproduction of 5-OH tryptamine, that is 5-HT, you call that, which may use more than 60% of tryptophan. So if there is the 60% of tryptophan is already used, you have less tryptophan to make niacin. So this may also cause pellagra-like symptoms. In Hartnett's disease, pellagra may be associated. Now here, tryptophan deficiency occurs due to genetic defect in membrane transport mechanism for tryptophan, resulting in great loss of amino acid. So there is a membrane transport mechanism which absorbs this tryptophan. There is a genetic defect in this membrane transport mechanism, so tryptophan cannot be absorbed. There is loss of amino acid, and hence no tryptophan, no niacin, ultimately pellagra-like symptoms. The reason may be intestinal malabsorption and failure of renal reabsorption mechanism due to this genetic defect. So deficiency, this is just a summary. Glossitis, severe deficiency leads to pellagra, and they have just discussed the dementia, diarrhea, and dermatitis. Niacin toxicity, excessive dosage can produce toxic effects like dilatation of blood vessels and flushing. Flushing means all this redness of your cheeks and face. skin irritation, and can produce liver damage. Facial flushing, it is induced by prostaglandins. Hyperglycemia can occur, hyperuricemia can occur. Okay, so actually excess can cause dilatation of blood vessels, ultimately can cause flushing. There is liver damage, skin irritation. Okay, one thing that niacin and nicotinamide, they have this similar physiological functions, but the pharmacological functions of niacin can only be done by niacin, not nicotinamide. Okay, niacin is used for the treatment of hyperlipidemia. So at higher doses, like niacin at doses of 1.5 gram per day or 100 times the recommended dietary allowance, niacin at this dose strongly inhibits lipolysis in adipose tissue. You know, lipolysis means breakdown of fats. When there is breakdown of fats, so you have circulating free fatty acids. Now your liver uses these free fatty acids to make neutral fats, like called tags. Okay, then tags then produce the lipoproteins like LDL, VLDL, which cause hyperlipidemia. Okay, so now what is happening? Niacin at higher doses is inhibiting lipolysis so that it cannot produce free fatty acids. The liver normally uses these free fatty acids to make tags. Thus, niacin causes a decrease in liver tag synthesis, which is required for very low density lipoprotein production and then LDL. Okay, so actually it is acting as a drug for lowering the cholesterol and the LDL, VLDLs in your body. So thus both plasma tag in VLDL and cholesterol in LDL are lowered. Therefore, niacin is particularly used in the treatment of type 2b hyperlipoproteinemia, in which both VLDL and LDL are elevated. The high doses of niacin required can cause acute prostaglandin mediated flushing, and aspirin can reduce this side effect by inhibiting prostaglandin synthesis. Okay. So here, an 87-year-old woman is brought to the emergency room from her nursing home for increased weakness. By report, she has been increasingly depressed and has recently admitted to secretly throwing out her food tray. That means she is anorexic. She is depressed. You are able to establish a good rapport with the patient, and she tells you that she has not eaten a healthy meal in more than 2 months. She has been eating some staple diet. She also reports that over the past 3 weeks, she has developed a watery, non-bloody diarrhea and is having difficulty remembering things. So, diarrhea and dementia. When a physical examination reveals several dark, scaly patches on her face, neck, and dorsum of both hands, dermatitis, you begin to suspect that patient's presentation is related to part of nutritional deficiency, and that is niacin. Hopefully, you got this niacin, and the deficiency is very, very important sources, and definitely everything is important, but when you talk about the deficiency disease, this question has been repeated so many times, so you have to take in account this as an important question for prof. So tomorrow we'll be doing another vitamin. Hopefully you understood. Thank you very much.